So I'm super excited for us to finally be able to get together because this is something we've been talking about for a bit.
Yeah.
So my name is Mandy Dennis. I'm the Director of Hygiene Operations for 7 to 7 Dental and Orthodontics. I've been a hygienist for 14 years. I was an assistant prior to that, as well as other responsibilities in the office, and a total of 26 years in the dental field.
My name is Shay Green. I'm a hygienist at Cibolo location. I've been a hygienist for 13 years now. I was an assistant before then, so 25 years total in the dentistry world. Loving it.
Very cool.
Yeah.
And
my name is Tanya Barajas. I am at the Potranco location. I've been a hygienist for 10 years, dental assisting prior to that 5 years, so it gives me a total of 15 years. And I love it. I love changing the patients as far as making their smile and everything like that. So, yeah, definitely.
And I'm Rosie Jarvis. I'm from the Alamo Ranch location. I've been a dental hygienist for 14 years. I was not an assistant prior to this, but I ran to the dental field as quick as I could.
so I put a questionnaire out to patients a few weeks ago asking them, what are some things that you want to ask your dentist or dental hygienist but have always been afraid to do so?
Yes.
And then I ask you guys, what are the most commonly asked questions that we get from our patients? What do you guys think the most common question to ask, either that they do ask us or that they wrote in and asked about was? Whitening. They always want to know about whitening. It doesn't matter what else is going on, but they want to know about whitening. So, Rosie, tell me, how do you approach the subject with whitening? Do you wait for your patients to ask you, or do you mention it to them?
They do the hard work for me. They bring it up 9 times out of 10.
Yeah.
And it makes it easy to open the conversation. And oftentimes they've already tried something, so we're already sort of using each other as sounding boards. They say, oh, I've tried this. It didn't really work. What do you think? Well, usually we start with a toothpaste. It's easy. It's a stain remover, but then I explain the difference between, all right, well, do you want a stain remover or do you actually want to change the color from the inside out? And that brings a whole other level to the conversation.
That's awesome. What about you, Shay?
Same. They usually kind of ask me, and then I kind of evaluate if they're a great candidate for whitening. Should they do it right away? Do we need to wait? So we just kind of take it step by step.
Okay. And Tanya, what about those patients that talk about sensitivity?
Those patients, it's pretty much that we just kind of hold off a little bit, and then depending, we do have different options if they want the whitening. We can do in-house because of the whole desensitizing, like ingredient that's in there. But we'll kind of ease back to try to control the sensitivity first before going full throttle with the whitening toothpaste or anything like that.
Yeah. I think it's interesting, for a lot of our patients, especially within our office, something that we offer is whitening for life.
Yes.
Right?
Yes.
And it's such a cool opportunity that our patients can get healthy and then they have an opportunity to get white, or get whiter teeth, right? They can have whiter, brighter teeth at a healthier state. And then they can continue to get whitening just by being a patient and coming in every 6 months for their cleanings. How often are you guys using that to help encourage your patient? And then what's the conversation that you have with your patient about it?
So basically, I just tell them, I get you healthy first. And then once you're healthy, we'll make those trays for you. Every 6 months you come back, we'll give you a syringe of whitening gel. And you kind of whiten at your own leisure. When you're ready to whiten, you can whiten whenever you're ready to kind of touch up. You can get as white as you want, then save it, and just kind of touch up as needed.
Yeah.
Yeah.
I agree. And then, Tanya, do you have a lot of your patients that, what is their response to that usually?
Well, usually they just love the fact that it's free. They're just like, oh, I just need to get that taken care of, and it's free every time I come in. Yes, as long as you can continue to come in.
Yeah.
You'll get a free syringe, and they love that.
Yeah. And so they're staying healthy.
Yes.
And they're getting something for free.
Yeah.
Yes.
Yeah. Rosie, how do you approach it with your patients that maybe have a few fillings, though, that they're needing to get done, and then transition into that? What do you do?
It's motivation. As soon as you take care of getting your overall oral health restored, we can absolutely give you this benefit that you're wanting.
Yeah.
So it's sort of like, we'll give you what you want and what you need.
Oh,
Yeah.
I like that.
Yeah.
Give you what you want and what you need.
Yeah.
Because that's really what they really want, right? And I know for me, whenever I've got patients that ask about it, I do the same thing, kind of like what you were talking about. We talk about the toothpaste, but it's stages. For some people, they want it right and bright right now. Maybe they've got an event coming up. Absolutely. So we can do in-office whitening.
Yes.
But for some patients, and even for most patients, they do want the less expensive way to go. And so there's definitely the toothpaste route that we can do that. Or there's at-home route. Let's do that. So just knowing that there are different options definitely makes a difference.
It does.
Yeah. So another topic that was really asked was, why are my teeth so sensitive? I mean, we've got a rabbit hole.
Yes.
So because every single person has something different.
Yes.
Right? It could be, and it's not just my teeth are sensitive. Well, how are they sensitive? Are they sensitive to? Exactly.
Hot, cold.
Sweets.
Yes.
Hot. Everything. Do they wake you up in the middle of the night? Those kinds of things.
Yeah.
So there is so many things that could be attributed to. Rosie, what do you find is the biggest reason? Like when you ask that patient, okay, what kind of sensitivity? What is typically the biggest sensitivity that people have?
Cold. 100%. I was eating ice cream. I was chewing on ice. Like, well, okay.
You can have the ice cream, but not the ice.
Yes.
So what do you tell them?
So we start off with, okay, well, let me take a look at your enamel. Your enamel might be thinner in some places. You might be chewing on things that are too hard too often, and that might thin your biting surfaces.
Yeah.
And then if those two things turn out to be okay, then it might be something else. Like maybe you need Sensodyne. Maybe you need something like a doctor to take a look at if you need a night guard.
Oh, that's true. Yeah. What about you, Tanya?
The same thing, like as far as asking the questions, what's triggering the sensitivity? A lot of the times it is cold. But also what I've noticed is just how their diet is as well, like what they're eating on a daily basis, because that triggers the sensitivity a lot. So if they're constantly sipping on, Route 44, like of course their sensitivity is going to, increase with that. And then pitching the sensitive toothpaste and everything to help decrease that.
Yeah. Shay?
Same. Sensitive toothpaste, brushing method. If they're brushing too hard, they're using a hard toothbrush, aggressive brushing.
Oh, that actually reminds me.
Yes.
So why do they sell medium and hard toothbrushes if I can't use it?
I have no idea. Who knows? I don't know. Clean your shoes with them. Clean towel. Who knows?
Exactly.
They shouldn't be out there.
I agree.
But they're definitely causing problems with our patients.
Sure.
I guess they just, they figure if I'm brushing harder, if I have a harder surface or substance that I'm using, I'm going to get that stain off, or their teeth are going to get whiter.
Yeah.
When in reality, it's just causing more harm than help.
Right.
So, yeah.
So we have those patients that it's not just the enamel, like what you were talking about, Rosie, right? It is root exposure.
Yes.
Okay. We've got recession that is happening. I'm a patient. I come in, I can see, this part of my tooth is a little darker or a little, more yellow. And it looks like something is going on and it's real red or for whatever reason. How do you explain recession?
Basically, you start to have root exposure. You're removing the gum structure off your teeth. I mean, removing the gum structure, or you're removing, that first layer of the enamel, and then you're starting to see the dentin, or you're starting to see root. And so that's what's causing that sensitivity. And then we kind of go from there. Okay, what can we do first? If we're going to do a sensitive toothpaste, if you need a restoration, if you need, let's figure out what you need.
Yeah.
Yeah.
Yeah. So restoration being filling.
Yes.
Got it.
Gotcha.
So what about, so Tanya, for you, if you've got that patient who has exposure of the root surface, right? We've got that recession. How do you talk to your patients about the sensitivity and how it can be fixed?
First, I go over as far as how they're brushing their teeth. Sometimes, most of the time, a lot of them are just being aggressive, as they're brushing. So I'll have them demonstrate well, when I'm back there, or I noticed it was yellow, so the harder I brush, I'm thinking it's going to come off. And it's just, we need to just take it easy to, help with that so we can decrease the sensitivity.
Rosie, do you ever have those patients where it's pretty extreme? And
Every day.
It's not just a filling that we can do on those root surfaces. Are there something that you specifically talk to the patient about as, yes, you have this recession, yes, you have this sensitivity. It's a little more than what we're going to be able to traditionally just take care of with some toothpaste and or fluoride and things like that to help with sensitivity. How do you talk to patients about that type of recession?
The beauty of patients coming in on a regular basis is we have these modalities that we use, like gum measurements, to compare to their previous visits. All right, has it changed? Let's check that first. And if it has, well, maybe we need to be more collaborative with a periodontist in our community so that maybe they can cover it back up with a gum graft or a filling and a gum graft, because we might be able to do that if there's too much structure of the tooth missing, not just the gum. So it's really beneficial for patients to come in frequently enough for us to, number one, assess, has it changed? And number two, why? And then number three, do we need to bring in a specialist to help us treat you?
That actually was perfect, because I think that leads back to the whole rationale for coming in, right? So that we can regularly monitor these things. If we don't see you, we don't know how quickly is it happening. And
if you're only coming when it hurts instead of every 6 months when we should see you, then yeah. And it kind of gets a little, it goes, pretty fast.
I agree.
Yeah.
That makes a huge difference in being able to do something too before it gets to a point where there is a bigger problem.
Yeah.
Yeah. What about erosion? This goes back to, you were talking about with Route 44 drinks, right? Erosion is not just, it's not just recession in the sense of, Rosie, you mentioned it might need more than just a gum graft. It might need an actual filling and the other, right?
Yes.
So erosion happening because of the mechanical portion of it a lot of times, right? What is a way that we can truly fix that? What do you guys think? I think a change of habit.
Yeah, definitely. Night guards, change of habits. You're biting the candies or like the Lucas and the all that stuff, and the lemon, the sucking on the lemons and things like everything that we love to do.
Pickles.
Yes. All that chamoy and all that good stuff that you just can't, once you start eating it, you can't stop eating it, but then it hurts your teeth. My big thing is Sour Patch Kids. If I'm on a road trip and I get Sour Patch Kids or the strawberry straws, and about an hour into my, I know, I do it, so I know they're doing it. And I mean, an hour into my trip, I'm eating all this, and I'm like, oh, that's starting to hurt. Maybe I should stop. I'm like, when I get to work, I'm gonna do a fluoride treatment because this is hurting. But so it's we live it too. We're human. We know what you're going through, and we know it tastes good, but it's not always good for you. So,
and you saying, I love when you made the comment, you're like, I gotta do a fluoride treatment. So when our patients are coming in, how often do you guys think this is so funny. Fluoride is not just for kids.
No.
And I think that so often, I have an adult patient who will come in and I'll see this, they'll talk about their sensitivity, or I see this recession, and we'll start talking about their sensitivity and why they have it and those kinds of things. And then I'll let them know, you know what, I really think let's do a fluoride treatment for you today. This is going to really help to strengthen a lot of those areas where you have sensitivities. How often do you guys have patients that'll tell you, adult patients that tell you, oh, I haven't had to do that since I was a kid, right?
Yeah.
So how do you guys talk to your patients about the fluoride and about, even as an adult, you need this? How do you guys do that?
We now know the magic word.
Yes.
Well, we now know that you benefit too.
Yes.
And it's not only do you benefit, but it lasts until we see you again, ideally.
Yeah.
If we're seeing you in 6 months.
If we're seeing you in 6
Yes.
months. Yes, ideally.
So do your part.
Yeah.
I'll do my part. And we're going to keep you healthy.
Yeah. Help me help you.
Help me help you. Exactly. Tanya, how do you have that conversation with your patients about fluoride?
It's usually where they come back and they compare it to when they were younger. They're just like, well, I didn't think I would need it anymore. It was only when I was a kid. Well, we like drinking that coffee every morning, don't we? So that will definitely help remineralize your teeth on a daily basis.
Very good points. I agree. So I have heard this saying before, pink in the sink. Have you guys ever heard of that? And it was like, oh, this is normal. I'm going to floss or I'm going to brush and there's pink in the sink.
Yes.
And I'm like, no. When you wash your hands, do your nails bleed? If they did, that wouldn't be normal.
Yeah.
Any part of us.
Any part of you. Exactly.
Just like when you're brushing your hair, does your scalp bleed? Like,
Yes.
no. It all goes together.
Exactly. So this patient will come in. My gums have always bled. Or I started flossing, but then I noticed that my gums were bleeding. What do you say?
So, when it comes to flossing and they say that, oh, it hurt or my gums bleed, I always like to tell them flossing is like exercising. When you first start doing this exercise, your muscles are sore, they hurt. But you keep doing it, it goes away.
Yeah.
Same with flossing. It's going to hurt. It's going to bleed. But if you do it every day, by day 4, day 5, you notice a difference. The bleeding will subside a little bit, decrease, the pain will go away. You just got to hang in there, keep doing it. And they're like, okay, that makes sense.
Isn't it crazy how much we talk in analogies?
Yeah.
But because it makes sense, right?
Because you got to kind of relate to them. You know, I
Yes.
could talk to you on a professional level all day long and it's going to go in one ear and not the other. But if I make it to where you understand, then I tend to get a better result with my patients.
Yeah.
Yeah.
Yeah. Rosie?
Yeah, same thing. I even I tell patients, if you see bleeding, that is our number one indicator something is wrong.
Yes.
I start that off right away. There is a problem. And it may not be one that you might be aware of. But we know.
Yeah.
So let me explain it to you.
Yeah.
And like Shay said, find a way that works for them because maybe it could be different for an older patient versus a younger patient. It could be different for a man versus a woman. So for my guys, I just talk about how often do you change your oil.
Yeah.
There you go.
If you got a leaky anything, what do you do?
You fix it.
Your gums are leaking.
Yeah.
Let's fix it.
Tanya, what about those patients, I'm only going to use floss picks, because I am, personally, I look at it that if something is better than nothing,
Yes.
and if you're not going to use traditional floss, if I can get you to use a floss pick to break up the bacteria that's developing between the teeth, and you start doing it in a time where the tissue is healthy or your gums are healthy, then you're going to reach those areas. What about those patients for you that are coming in and they're just like, I'm only going to use floss picks?
I'll demonstrate as far as especially flossing towards the molars. I'm all like, can you feel how I'm actually going from side to side with the string floss? I go with the floss picks. You can't really do that. So that's why, you'll get the inflammation around those areas. But then going back, we'll get those that are like, well, I'm just going to use the floss picks.
Yeah.
Okay, but
and that's what you can do is demonstrate.
exactly.
Like,
Yes.
rub up against the tooth to make sure it goes underneath the gum line.
Yes.
Then it's a good thing to use. And I always tell them to use more than one for your whole mouth, for the love of God. Use one whole little floss pick for the whole mouth. No, use at least 4, 1 per quad.
Wow. Okay, that's a new one for me.
Yeah, because you use the whole. No, that's disgusting. Yeah, so I always tell them use 1 per quad. That's what I do.
It's breaking up the bacteria.
There you go.
That's where my whole thing goes back to. It's breaking up the bacteria because I would rather you do something than nothing.
Yeah.
And if you're not going to use traditional floss, for me, I'm okay.
Yeah.
I would rather you be doing something.
You got them doing it. Yeah.
Especially with like guys with great big hands and they're like, I just can't get the floss in there. And it's like, okay, well then let's try something else. This is something I don't see very much of anymore, but it does still exist. Floss holders.
Oh,
Yeah. Yeah.
I mean, yes, it's a little more mechanical. I mean, in the sense that you have to put it on, string it across, bring it down, but it's
Wrap
the
it around.
ultimate floss pick
It is.
with
It really
traditional
is.
floss.
Yeah.
For those people who want with traditional floss, has to offer, but if their hands are bigger or if they have dexterity issues,
Yes.
there are, again, other options. Or there's water flossers.
Yeah.
yes.
How often are you guys recommending water flossers?
I recommend water flossers, but I still ask them to get some floss in between their teeth a couple of times a week.
Yeah.
That's just me preference. I
Yeah.
feel like it can't get to everything, but
Sure.
it's a great thing to use.
Yeah.
So
Okay, here's another one. How many people ask electric toothbrush or manual toothbrush? And
All
what do
of
you
them.
guys,
every day.
right?
All day.
I see
Yeah.
10 patients. I'm asked 11 times now.
Yeah.
So, okay, this is me being transparent. I don't like electric toothbrushes every time I brush my teeth. Whenever I brush my teeth in the morning, I don't use an electric toothbrush. It's too much. I'm just waking up. I need to use the manual toothbrush.
Yeah.
I probably take a little longer in the morning just because it's first thing in the morning.
Yeah.
And I need to just kind of take a minute and not have all of that additional electric toothbrush stimulation that I'm going to get.
Yeah.
So how do you all answer that questions to your patient? Tanya, how do you answer that question?
Well, I first check like as far as like how the patient is like in the beginning to start off with, you know, because a lot of the times if they don't like the vibrations, how you don't like it first thing in the morning, it's just like, well, I don't like just the fact that it's like that in my, okay, well, you know, there's different options, you know, as far as the different vibrations of the electric toothbrushes, you know, like if it's someone that already has heavy plaque, of course we would definitely want to offer that to them because that's going to help them out to remove all the plaque that they were leaving there before with a traditional toothbrush.
Yeah.
Right. What about you, Rosie?
Same thing. Thankfully, there's so many different options now. You walk down any dental aisle, it's overwhelming. The choices are
like a toy
aplenty.
store. Yeah.
It's like a toy store, especially for us, right? But the good news is they do have options. There's sensitive options, which vibrate at lower settings. There are lesser power ones that are not necessarily sonic based, but are spin based. The thing is, everybody has something for them. We just have to find it.
Yes.
And that's why I'll have patients ask, well, what do you guys have in the office? Or can I buy something here in the office? And the answer is no. But you can pull out your phone and let's go on Amazon.
Yes.
And the reason, this is one of the things that I love about who we are, is that each of us are looking at the patient that's in front of us and recommending things that are for them.
Yes.
It is not a one size fits all in dentistry. And I am confident in how I get to take care of my patients, that they're not just being recommended something because we have something sitting on a shelf or because we're getting a kickback for selling something. We're recommending what they need based on what they have a need for. So thank you, Amazon. I don't get a kickback for that either. But thank you, Amazon, that the patient can pull up their phone and I'll tell them, look up this. You know, you don't need something with all the bells and whistles. Sometimes maybe the bells and whistle is what they need, but it's not for every single person, right? Shay, what about those patients that ask you? I mean, do you ever recommend a manual toothbrush over an electric toothbrush?
Exactly, I will. Absolutely. If I have a patient that comes in and has great hygiene already, and they're like, should I use a spin brush or should I use a Sonicare? Should I use an Oral-B? I'm like, what you're doing right now is perfect. It's great. If you want to get it just because, by all means, go ahead and try it.
Yeah.
But no, you don't have to. Not everybody needs it. If I have a patient that's full of plaque everywhere and they're only using a manual, then I'm going to be like, hey, have you ever tried an electric toothbrush before? There's so many out there. Let's find the one that works best for you.
Right.
And then kind of reevaluate when they come back in the 3 or 6 months and see if that's working for them. And then just kind of go from there.
Yeah.
But yeah, not everybody needs an electric toothbrush.
And I think too, for patients, like say for example, ortho patients.
Yeah.
One of the really cool things that I will say we do, and it's not that we sell it to them, but we do provide a Sonicare toothbrush.
Yeah.
For all of our patients that are going to traditional ortho. Okay. They've got all these brackets everywhere. They've got wires. They're going to need the additional help than what a manual toothbrush is traditionally and typically going to do for most people. So we do provide that for our patients at the beginning of their traditional orthodontic treatment.
Yes.
Because they need the help. But that's not for every single person.
No.
You know, I'm like you, Shay, that if it's not broken, don't fix it.
Exactly.
So if you're doing a good job, why do I need to change the habits that you already have?
Yeah.
I want you to keep up with that. What if they go to an electric toothbrush and they're still brushing like they would normally be brushing?
Yes.
Because I think that that's a lot of times what happens with people when they switch to an electric toothbrush. They think, oh, I'm just going to brush like I would normally brush, but they can't.
No.
You know? So there's a trick to it. Right?
Exactly.
Guide the brush. You
Yes.
don't brush with the brush.
Exactly.
So I think that that's really important that they understand as well.
I agree.
Yeah.
There's a learning curve.
Yes, it is.
Yeah.
You just gotta find the one that works for you.
Yeah.
Like some people like the spin, some like the isolation. So
Yeah.
you never know. Find your niche.
Yeah, agreed. We all work in different offices. We're open 7 days a week. We have patients that a lot of times may want to see a specific hygienist. What do you guys tell your what about that patient that comes in and says, well, you're someone new?
Yeah. And I'm like, no, I've been here 3 years. But
Yeah.
nice to meet you.
Yes.
No, I just explained that we're open 7 days a week. We work 3 days a week.
Yeah.
Sometimes life changes, our schedule changes. However, we do send you a little text message every morning to tell you who's going to be here that morning. So you can expect to know who you're going to see when they come in that day of. But yeah, we tell them we work 3 days a week and we have families. And sometimes I have to switch a day with someone else and I'm not here. But we try to accommodate and see the same patients, but you know, anybody can take care of you. We're all trained. We're all professionals. We're all happy to see you.
And I think that's such a big deal because we're open 7 days a week. You know, from 7 a.m. to 7 p.m. Monday through Friday.
Yes.
And on the weekends. It isn't possible for any of us, obviously, to work 72 hours a week. So we can't be there every single day.
Yeah.
And we have an opportunity to take care of a lot of people. So to think that we're going to catch that person every single time, it's impossible, right? We'll do our very best. Like Shay said, you know, we'll do our very best. But what do you say to that patient that says, you know, I thought I would, you know, you're not the person that I saw last time. What do you say, Tanya?
Oh, and I say the same thing. Oh, I've been here already for a while. I just haven't made my rotation with you yet. You know, I'm all like, now you get to meet me, and pretty much we all work the same. You know, as far as we review everything, and you know, we ask them like right off the bat. You know, when you have your cleanings, any sensitivity, build that relationship with them. Oh, okay, she's actually caring. Like how the cleanings go and everything, and then it just goes pretty smooth after that.
And it's amazing to me. One of the things that I get an opportunity to do is I get to work in all of your offices, right? So I do every once. I mean, it is rare that I'll get to see the same patient the next time.
Yeah.
But if I do, it's obviously it's amazing. I do get.
Yeah.
Just like our patients do like getting to see us, we do like get to see the same patient, right? We do. We're building that relationship and we get to put our eyes onto something that we didn't get to see or we did see the last time. Is it improving? So it's exciting for us too. But as a patient, if I were going in and seeing someone different, you know, I've had patients who have told me, I've seen somebody different every single time that I've been here. I will tell them, you're pretty lucky because you actually get an opportunity to have someone else's eyes. Maybe I didn't see something last time.
Exactly.
And you get an opportunity to get someone else to see it too. So I think that's actually very cool.
Yeah.
You know? And I know the people that I get to work with, and I'm glad that they do get an opportunity to be taken care of by someone else. That's how you also may find the person you may not even realize that you do like somebody else better.
Exactly.
And then you get them and you're like, holy crap, that was awesome. So even though I know for some people they prefer to see the same person, there is an opportunity, like you said, Shay, they get a text message in the morning that tells them who's going to work there.
Yeah.
They are able to either text back and say, you know, hey, I would like to be seen with so-and-so.
Yes.
Can I schedule for that day? Or, you know, we typically have the same days that I know you guys work. And we do try to schedule those patients on those days.
Yeah.
But I do think that it's important for our patients to remember that we don't get to work 72 hours a week.
Yeah.
But we will be open for what they need. And that's
Exactly.
the most important part for them to
Yes.
remember is that there is someone that is there to take care of them every single day
Yeah.
of the week.
They'll always be in good hands.
Yeah.
Yes.
Like whoever
Always
you
be in
get,
good hands.
we're all going to take care of you.
Yeah.
Yeah.
I know I am currently due for my yearly checkup on my eyes. I think it's amazing how many patients forget they're supposed to come in twice a year for their dental cleanings.
Yes.
Your eyes are not changing as much as your mouth, right?
Yeah.
We go in for a yearly checkup with our doctor. We go in for all of these other things. We remember to get our nails done every 2 weeks.
Yeah.
We remember to go to our hairdresser every 6 to 8 weeks or whatever it is. Why do you think it's so hard for patients to remember that we should be seeing you twice a year?
Out of sight, out of mind, right?
Yeah.
Sometimes. That's why I love that we send our patients reminders. We try to follow up with them on a regular basis and hear from them, or make sure they're at least hearing from us, so we get that
Or when
reminder
they leave,
in.
we have your next appointment already scheduled for you. So
Yeah.
that's always great.
And I know, I don't know about you guys. I know for me, I'll have a patient who might say, oh, I'll call and schedule it. But just like I still need to call and make my yearly vision exam, and I love my optometrist, she's fantastic. But like you were saying, Rosie, if I don't get it scheduled, I'm not going to think about calling in to do it. It's out of sight, out of mind. Oh, that's right, I need to do that. Oh, I need to call and I need to make that appointment. But at least if I have a placeholder,
Yes.
you know?
Yes.
And even if that day or that time doesn't work perfect in 6 months, at least I know I'm going to get a reminder so that I can call
Yes.
and get it rescheduled, as opposed to, I need to call, I need to call, I need to call. This one, it's set for me,
Yes.
and I know I'm going to be able to come in and do it. For patients who have insurance, their insurance pays for it twice a year for them to have a healthy cleaning
Yeah.
twice a year. So we want our patients to stay healthy.
Yeah.
So for those patients who, they're doing their 6-month cleanings or whatever, reminding them, hey, let's make sure that we're seeing you every 6 months so we can keep you healthy and we don't fall into a state where maybe you're going to have bigger needs. I think that's really important.
Yes.
Right?
Maximize
Yes.
those benefits.
Maximize your
Yes.
benefits.
Yes.
Then, though, I would also say for those patients who think, okay, I can't afford it because I'm only going to come in one time a year,
Yes.
where we're unique is that we have a membership plan for our patients. For those patients who do not have insurance, or honestly, for patients, some patients who may not have a really good insurance opportunity within their office, or it's expensive wherever their workplace is, right? When I say
Yes.
their office. So wherever they work at may not have a good option.
Yeah.
Our membership plan is incredible because they get 2 cleanings a year. They get their, if something's hurting, they can come in and still see us. And the discount that they get on their dental treatment is actually far exceeds what a lot of insurance plans can do,
Yeah.
right?
Yes.
So I cannot stress enough, or how do you all encourage patients? Like I'm rambling at this point, but how do you encourage your patients? It is important to come in twice a year. What do you do?
I stress it to them. I'm
Yeah.
all like, it's very important because so much can change within 6 months.
Yeah.
There can be something that we're watching, and if we don't see you in 6 months, it can turn into something a lot bigger. you
Sure.
know. So we want to make sure, as we always stress, that those gum tissues stay nice and healthy, so you can, just take advantage of what you're paying for already that ends up being free when you come in here.
Yeah. Shay, you were talking earlier that some patients get into a routine of everything is once a year.
Yeah.
Right?
Yeah.
So this is once a year.
Yeah.
How do you remind those patients? I know you said something about, making sure that they're scheduled.
Yes.
But while you're actually in the appointments, what are some things that you talk about?
Basically, things that I see, like if they haven't been in a year, and I'm like, well, how long has this tooth been broken? Oh, it's always been like that. I look back, I'm like, no, that a year ago when you were here, that was not like that. So somewhere in that year, it could have been 6 months ago. We could have caught that. It's just things like that. Just we want to stay on top of it. We don't want you to kind of get brushed underneath the rug.
Yeah.
So we want to stay on top of that. It's very important that you're coming in every 6 months. Some people just believe that, like everything else, is once a year, and it's just not. It's not
Yeah.
one of those things.
And then one of you were talking about, we do send out text messages. We send out reminders. We get reminders on our texts, so many texts a day, right?
I got one this morning. I have my chiropractor appointment today. Totally forgot about it. Thank you. Okay. When I leave here, went to the chiropractor.
Which is extremely important in
Yes.
our line of
Yes, it
business,
is. Yes, it
right?
is. Yes. Yes.
So just like those kinds of things are extremely important for our maintenance of
Yes,
what we do,
Exactly.
patients have to have the maintenance on their teeth. I so often compare it to getting your oil changed on your car. The car won't go the length of time that it needs to go if you're not getting your oil change, if you're not getting regular maintenance on your car. Well, we use our mouth, or, our teeth more than... They are a very highly used organ.
Yeah.
So we need to make sure that we're maintaining them so that we can keep them forever.
Yes.
Right? Yeah.
And then
Anything
it's not
else?
just your teeth. I mean, oral cancer screenings.
Yeah.
How long has that lesion been there? How long has that bump been there? You know, I mean, that's something you catch it. The sooner you catch it, the better.
Absolutely.
You know?
And there are things that we see, whether it be under the tongue or on the backs of the cheek. It's not like we're looking at those things whenever we're brushing our teeth.
No.
Right? So that's actually a huge point.
Yes.
Having someone else's eyes on those places.
Yeah.
Goes back to those magic words, right? We now know. We now know it's linked to heart health,
Yes.
brain health,
Yes.
all kinds of major
Alzheimer's,
organ
dementia,
health.
all that bacteria in your mouth can go
Exactly.
so much further.
Yeah.
So,
Yeah.
6 months. Super important.
they're very important.
Yeah. All
For the
right.
healthy mouth, however, if you have periodontal disease, want to see you every 3 months.
Yes. This is true too. This is true too. So that it doesn't
pretty
advance even
different,
further.
Exactly.
right?
Yep.
I think that's where
Exactly.
our clinical knowledge really comes into play, right? Because we now
Yes.
know that if you have bacteria in your mouth, it's negative. It only takes X amount of time for it to turn over and repopulate and grow.
Yes.
That's a huge difference. You're right, Shay.
Yes.
Yeah, 3 months versus 6.
Yeah.
I'm glad you mentioned that.
Thank you.
All right. Thanks, guys, for hanging out. This was fun. I think that this is part of, us becoming better clinicians, too, is that we get to sit down, we get to talk about all of the different things that are going on, things that you see as opposed to the things that I see and you. How do we make this better, not just for ourselves, but for our patients?
Yeah.
Right? I mean, that's one of the reasons why we have as many offices that we have throughout the city, is that we want our patients to have an opportunity to come in 7 days a week, right?
Yeah.
That's convenience. It's not just days, it's hours. That's why we're open early and after work.
Yes.
And why, the three of you are, Shay, you're at Cibolo,
Yes.
way up on the north side.
Yeah.
You're at Potranco, which is on the complete opposite corner of the city.
Yes.
So our patients have this huge span of offices that they can find for availability, not just days and hours, but location to wherever they are, right? And there are obviously more than just the 3 that are represented here.
Yes,
We
yes.
just don't have enough chairs
Yeah.
for everyone.
of us.
It would be a lot of us.
lot of us.
There was a lot of us.
Yeah.
So, I would definitely recommend, if you're a patient who is looking for a dental office that needs something that is convenient for your life,
Yeah.
that you don't have to take off work, you don't have to take off your kids out of school, it's close to your house, going to the website 7to7dental,
Yeah.
.com, going and doing that, checking out our Instagram, having resources available of not just who we are as a dental office either. That's I didn't get into the dental business just to take care of one patient in my chair. I do it because I want to take care of people as a whole.
Yeah.
And in our office, we get a chance to not just take care of the people that are in our offices, but we take care of our community.
Yeah.
Right?
Absolutely.
So I would definitely recommend for people, go to our website, go to our Instagram, go to our Facebook, find out who we are and how we can take care of not just you, but taking care of your family. That's a very cool way of thinking about it, right?
Absolutely. Yes.
We're family dental. Yes, it's a family
Yeah,
dental.
let our family take care of yours.
Aw.
Exactly.